of the things, real quick, as people go through, if you have questions and answers, be sure and use the question and answer thing at the bottom of the screen.
Jim, just to focus on what Toby just mentioned. Well, now clinical engineers, another adjective for us is jugglers. And yesterday, Dan, he said, clinical engineers are like Cinderella. We're never invited to the ball. Thank you very much, Toby, reminding us about Dr. Detros' WHO for clinical engineers to be ready, and we are on the map. It's important to add data analytics as part of clinical engineering program, talking about the health technology lifecycle and the link with information, mentioning the priority medical devices for the WHO. The oxygen concentrators, although they're not too much used in the States, but they are needed when we're changing the functionality or floors to ICUs or to different types of services, especially with the COVID, and mentioning the WHO training. Great job that you're doing, Toby and Bill. And I wish to remind as well that we are on live on Facebook. Now we're going to Dr. Jitender Sharma from India. He's a CEO of AMTZ, and he's going to talk about recruitment and staffing. The floor is yours, Dr. Jitendra.
Thank you very much for this opportunity. And I will request if you could allow me to be the presenter, because I reduced the number of slides to have more time for discussion, if that is possible. Yeah. And I hope you are able to see my screen now. Yeah, can you see my screen?
Yes, we can.
Yeah. So AMTZ, as you know, is a large enterprise with more than 3,000 people working, about 60 companies, private companies that are supported by the government, and scientific facilities that are required for medical devices testing, validation, prototyping. The unique challenge that we encountered was we had 3,000 people who had to be suddenly trained into manufacturing and maintenance of ventilators, COVID diagnostic kits, and so on. Till today, till this evening, we have been producing 500,000 COVID kits every day, about 150 ventilators every day, about 100,000 masks every day till this evening. And it has to happen tomorrow as well, and day after as well, and so on. But many of the private sector partners that were working with us had to suddenly migrate using their assembly lines to produce what was needed. If you see on my slide on the right hand side, there is a facility, RT-PCR manufacturing facility, which used to actually manufacture tuberculosis diagnostic kits. And they had to migrate to manufacturing COVID diagnostic kits. That single facility employs 600 people in 2.5 shifts, starts at morning 8 and closes at night 2. Now, the unique challenge we found, we encountered were three. One, training the people to take up manufacturing of products that were needed by the community. Two, maintaining those technologies across the country for the products that were sent. And three, occupational safety, because even these workers were infected in large numbers because they were living in communities and they were prone to the COVID disease as much as others are, perhaps more because of their unique position of working, one, with infectious samples, two, working in crowded places, and so on. So to take care of occupational safety, what we started is that in our licensed laboratory, we started testing 1% of our industrial workforce every week to ensure that we capture hotspots. But what I'm going to quickly share with all of you is our program of accreditation, national registry, and certification that stood with us like a bedrock, allowing us to train our occupational workforce in mitigating these challenges. I go to my next slide. We established the Indian Biomedical Skill Consortium, which now became Indian Biomedical Skill Council under the Ministry of Skill Development in the Federal Government of India, as a consortium of AMTZ, which is a public sector entity supporting multiple laboratories and multiple private sector entities, all in the area of clinical engineering, device manufacturing. The Indian Association of Medical Device Manufacturers, IMED, and the Quality Council of India, we joined together along with the government to set up what became Indian Biomedical Skill Council. The council approved 5 job roles which we think are very relevant to Indian subcontinent and also to many parts of the world, which is certificate in biomedical engineering, certificate in biomedical maintenance, certificate in biomedical manufacturing, biomedical quality assurance, and biomedical project management. Now, it's just by tradition that I'm using the word biomedical here. You can call it clinical engineering maintenance, and clinical engineering manufacturing, and so on. Because as a country, we don't differentiate between biomedical and clinical, but we differentiate between the levels of education, which is diploma or a full degree. All the IBSc training programs approved by Ministry of Skill Development during COVID for COVID related products were quickly synthesized as training modules. The National Skill Qualification formula, the NSQF level 5, 6, and 7 were accredited to provide the skill certification. Very briefly, I have shared with you here the modules that we cover on the various training programs leading to the skill certification, which is a full accreditation by the Indian Biomedical Skill Council. I'll be sharing this presentation as I have shared the earlier one with all of you, and you can go through the modules online as well. Maintenance, which is the bloodline of good quality medical equipment used in the hospitals. This includes the National Accreditation Board of Hospitals and National Accreditation Board of Laboratories modules as well. You see there M08 that allows clinical engineer to look not just at radiation safety and troubleshooting, but also look at quality and certification standards of the facility. Biomedical manufacturing, which is the fulcrum on which we could challenge the huge production targets, which includes testing, evaluation, operations, manufacturing and assembly, and materials handling. Not many clinical engineering courses across the world have actually targeted material handling and inventory management in factories, for example, as one of the training modules for clinical engineers. And that's was desperately useful in our case. Quality assurance, which included design and product control, verification, validation, risk management, and so on. And project management, which is managing people, managing technologies, managing technical requirements and technological infrastructure, all with a vision of handling the total project. Besides the accreditation and certification programs, the training programs that supports large-scale manufacturing, for example, ventilators that use sensors, flow meters, temperature, pressure, and oxygen sensing devices inside the ventilator. We brought out unique programs to allow training for technicians and biomedical engineers, clinical engineers, particularly in sensors which fail a lot more frequently than other things. On quality assurance, particularly of infectious samples, of COVID RT-PCR kits, overall biomedical engineering and project management. These trainings were initiated right during COVID, during online programs, and used for supporting all the workforce that were working with us in meeting the targets. Some of the training programs, the snapshots are here. Most of this training is now online, and the recordings of these trainings are on our website. Particularly biomedical project management and biomedical manufacturing. sensors were 3 programs that were used, and over 700 people were trained out of a total workforce that we have in our establishment, about 3,200 people. Were trained on these trainings, and multiple batches across the country were licensed also for training, so that when ventilators and other products reach the community, we have the right workforce. What helped us really was also to establish a huge registry of all clinical engineers trained as specialities, trained to handle ventilator, trained to handle diagnostic laboratory, trained to handle radiology. We bifurcated the database of clinical engineers that we had based on the skill set, and we made these skill sets, the database on these skill sets public, so that private sector, public sector, foundation or trust, any hospital or community health center could actually leash on to these data bank, look at the data that has been segregated skill wise, and tap the individual resources in their community or context. Skill Vigyan, which is training with science, we were fortunate again to have the federal government's approval to set up a dedicated skill center for biomedical and clinical engineering training. The center was opened 2 months ago. It has already has a vision to train about 400 people, not just on technical programs, but also faculty development for the country. We aim to develop 60 faculty per annum through this program, and about 20 enterprises, each with large number of individuals, through this new skill center, which is now supported by the federal government. The Indian Biomedical Skill Council has actually shown a lot of potential during COVID, and the role it can play, role it can allow the clinical engineering workforce to play in handling of pandemics. Across our multiple partners of Indian Biomedical Skill Council, some of which is given on the slides here, this skill council today can be easily relied upon, whether you need somebody to fix an electrolyte analyzer or an oxygen generator, simply because we have put 4 things aligned. 1, mapping of the health resources by skill. 2, training. 3, accreditation. And 4, on-the-job skilling when they go back to their hospitals or community. And we feel alignment of these 4 pillars have added huge strength to the clinical engineering sector in India, and we are extremely lucky that the workforce in India has benefited immensely with the vision of putting the 4 baskets concerning clinical engineering skills together, and ANTZ has been able to play a huge role in pandemic management. Thank you for the opportunity, and I look forward to questions.
Thank you, Dr. Sharma. Thank you very much for the presentation about the programs, and it is full of information. Please, we invite everyone to use the Q&A chat box. We're gonna pull and forward the questions to the presenters to answer them. It's great. It's great to see lots of colleagues joining in. A quick question, just in 2 minutes. Dr. Toby mentioned that data analytics and AI is recommended to be added to the programs. And it was nice seeing you, the program, Dr. Jitender, the materials handling, the inventory, and the facility design. Do you as well incorporate the data analytics and the artificial intelligence in your programs as well? Just a quick answer within a couple of minutes, and then we're going to move forward.
Yes, we do, particularly if the technology is on imaging or radiology segments. The artificial intelligence and data analytics come very handy.
Thank you very much. Thank you very much.